questions.
Yes. Okay, so I was not able to transfer them like I wanted, so I'm going to have to read them to you. Ask me if you need me to
Oh, okay.
repeat anything.
Okay.
How, usually, how long is your first session with a client?
Usually an hour,
Okay.
and that usually includes my explaining what, say, diabetes or gestational diabetes is doing to their pregnancy. Blood sugar testing. I actually do meal plans because when I used to work clinically, I was working often on Fridays where I didn't always have a nutritionist even. Sad to say. We kind of a lot of times switched off. But yeah, I usually talk exercise, not always, and a little bit of stress, but very little. A lot depended on the lady.
Okay, thank
Next
you.
one.
Next question. Can you please elaborate on how stimulates fetal insulin secretion is linked to delayed organ maturation?
It just, so things like in your lungs in particular, surfactant production is delayed. And your liver actually, they tend to store a little more fat. It's not, their liver then will not mature as rapidly. You end up with a kid who's more likely to be, what do you call it, hyperbilirubinemia and stuff. Just seems to delay both of those processes.
Okay, thank you. Can you address vegetarian recommendations as they relate to carbohydrates?
They still have to follow the carbohydrate levels at each meal. It's a little bit harder as a vegetarian, but usually they're getting all the nut butters, they're getting the tofu. There's actually a lot of options now that somebody who's vegetarian can have. It's just a matter of working them in because a lot of those options also have carbs in them. You know,
Okay.
again, just don't go over a level that causes high blood sugars.
Thank you. The next question is asking about the diagnosing hyperglycemia that we had on one of your slides. And it is on our website. You can download it. It is under resources and free material or under providers. I will put in a link for everybody to get that. Next question. How many packets of sugar substitute are in a 12-ounce diet soda or packet of Crystal Light?
I think they assume it's one.
Okay.
Can you hear me?
Yeah.
Okay.
Yeah, got that. Okay.
I just bumped my control, sorry.
Oops.
No,
Next question. What might you do with a patient that comes to you with an attitude? They seem annoyed to be there and don't want to be bothered.
usually that's the person I'm asking to actually test it out themselves. You know, do some blood sugars, and after they have that bowl of cereal or whatever they think I'm crazy, so they can't have, right? Often I feel like they need to prove it to themselves. The other side is where I work, at least I have a social worker. I'm thrilled I have a social worker. She's somebody who's going to go on the social worker schedule because there might be a lot more there than I see. You know, if they don't show up for social worker, I end up probably spending a lot more time talking to them about what's going on.
Yeah, perfect. What is the minimum amount of time for a fasting blood glucose when patient is monitoring? What if a patient only sleeps 6.5 hours?
6.5 is great. I usually used to do about 5 hours because I did have patients who did split their sleep because they were shift workers. And that's about as good as we could get.
Okay.
You know, so aim for 5.
Okay, thank you.
That's not really a true fasting, I know, but it works.
As long as it works. Okay, next question. Have you ever used telehealth when there is a barrier to follow up with a visit?
Yeah, we used to use a lot of email, fax, and phone. Even if I get it on email or fax, I used to call people because I almost always had questions about what I saw. worked fairly well with email. I could print out, and I could also type my response to them, and we use that in their chart. That would go into their chart. Same with fax. It went into their chart with notes on it.
Okay, thank you. Where do you refer a client if her Medi-Cal is only during postpartum? If her Medi-Cal is only during postpartum?
Oh, it's going to run out with postpartum, right?
Yeah, which expired 6 to 8 weeks.
Usually then we're doing a 2-hour glucose screen, so it's fasting and it's a 2-hour number, and it has to be where they drink that stuff, 75 grams, because you can't really do an A1C for a diagnosis because it's too soon. You really have to wait till almost 3 months postpartum. But we'll try and get that sometime after 5 weeks, before the 6 to 8 weeks when things run out. So at least we can get a diagnosis and maybe get her something like metformin or something. Just something so to take care of herself for a while.
Okay, thank you. That is the last question that we have. Leona, thank you so much. I've learned a lot today. Oh, wait, one more just popped up.
Okay.
If a patient is tested for GDM with a 3-hour OGTT, would a 2-hour OGTT need to be repeated as a cutoff value if the cutoff value is changed? And now it is, oh, okay. So we're talking about the 3-hour versus a 2-hour. If they've been diagnosed with the 2-hour, do you need to retest with a 2-hour? Does that make sense?
For retest after?
If a patient was tested for GDM with a 3 and has been diagnosed using a 3, do they have to be retested with a 2?
Oh, no. Once you have a diagnosis, even if you're using old guidelines, if they passed on a 3-hour, you're done. Don't keep retesting. But for after the pregnancy, if you had used a 2-hour or 3-hour, doesn't matter which one during the pregnancy, you still test after. If you diagnosed with an A1C early pregnancy, that's different.
Okay.
But theoretically, if you read the ADA guidelines for diagnosis, you can diagnose with an A1C early pregnancy. And California says before 13 weeks. After that, you've got pregnancy effect, hemodilution, everything else. You can't really use an A1C even.
Okay. How much do patients have to pay for Sweet Success? And as far as I know, nobody is charging anything outside of their regular pregnancy care. Did you charge additionally when you were at the clinic?
Yeah, we did.
Oh, okay.
I think it was actually a couple hundred an hour. I'm pretty sure it was about 200 an hour. I could be totally wrong. Most of our patients, though, after saying that, most of our patients were, we had CPSB, so a lot of them were Medi-Cal or had insurance. And I can tell you with insurance, I think they probably most of them were contracted, so even though they charged that much, we almost never saw that much.
Yeah, nobody ever does.
And that's...
I have an answer to the how many packets of the sugars are in a diet soda. One of our listeners says a Diet Coke contains approximately 5 packets of equal.
Ooh, really?
Yeah. Yep.
And when we say moderate, we mean 2 to 4 servings. So that would be 1 Diet Coke is too much.
Okay. So there you go. No Diet Cokes. Okay, so thank you so much. Thank you to all of our participants.